Hello mga kaPORKliners! So, today is another episode of Nursing and Caregiving Essentials. So, I am Nurse Linda or Nurse Ange by the way. So, you can follow me in TikTok and Facebook as well. Please subscribe po sa aking channel for more informative videos like this. Our topic for today is proper positioning. So this is a discussion and a simulation at the same time. So why do we do simulation? After the discussion, I will give you time to do the positioning or the procedure. I will give you time to explain it as well. Why do we do that? For better retention po. Magugulat kayo after that, after this video, ang galing-galing nyo na. You can do it na. So let's start. As a nurse, caregiver, or nursing aide, positioning is an essential aspect of nursing practice. It is an independent intervention we can do to help patients with their condition. So it's important po na alam natin itong mga intervention na ito to help our patients. For example, yung pasyente na nahihirapan po huminga, what are we gonna do? 'Di ba? What are we gonna do first besides vital signs? Ano bang kailangan posisyon ng pasyente? So these are the types of positioning. So we have 8: prone, supine, Fowler's, dorsal recumbent, Lysotomy, Sims lateral position, or Topnik position, and Trendel and Work position. Okay, so like what I said po sa introduction natin, we need to follow an activity kasi this one or this video is a simulation. So why do we do this? For better retention po. Hindi lang basta manood ng video, but I want you guys to take down notes and then after the discussion, you follow. Okay, you do the positioning, you give yourself 1 minute to do it on your own and then discuss the purpose of each position, record yourself, and surprise yourself. After this video, ang galing nyo na. Okay, let's talk about prone position. So, prone position is lying on stomach with head turned to the side. So, in Tagalog, nakadapa yung pasyente and naka-turn sa side yung kanyang ulo. Why do we do that? So, number 1, purpose is to relieve pressure on the back. Number 2, alam nyo ba na during the pandemic, the doctors has been using this position to relieve severe respiratory distress. So, according to research, marami daw nasagip na pasyente ito from tracheostomy. Okay, it's your turn. So position your patient to prone position and describe the purpose of this position. Record and surprise yourself. Next position is supine position. So the patient is lying on the back with arms on the side. In Tagalog, nakatihaya yung pasyente. So why do we do this? For physical examination, resting in bed, if the patient is undergoing anesthesia or recovering from anesthesia. So we position the patient that is post-operative na nagre-recover from anesthesia. So we position them on a flat or supine position without pillow to avoid spinal headache. Ayan, so that's supine position. Okay, so it's your turn. Position your patient to supine position and describe the purpose of this position. Record and surprise yourself. So the third one is a Fowler's position. So semi-sitting position ito with various degree of head elevation. So meron tayong high Fowlers, semi-Fowlers, at low Fowlers. Okay, so these are the types of Fowler's position. So depende po sa head of bed elevation. So sa high Fowlers po, 90 degrees. Semi-Fowlers, 45. And sa low Fowlers po is 30 degrees head of bed elevation. Okay, so let's start with high Fowler. So this one is yung 90 degrees yung head of bed elevation. So tuwing kailan po ito? Whenever the patient is going to eat or drink para hindi ma-aspirate or ma-choke yung pasyente. Next, this is to assist patient who has difficulty of breathing. So kapag nahihirapan yung pasyente mo, i-high Fowler's position mo. Why? Kasi sabi, sa ganitong posisyon, nama-maximize po yung lung expansion. Ayan, so that's high Fowler's. Okay, so the second one is semi-Fowler's position para daw number one, ma-comfortable si patient makapanood ng TV. Next, kapag may visitor si patient, ito yung pinaka-comfortable na position to converse with his or her visitors. Next is after abdominal surgeries, for example, this is to relieve pressure on the incision site. So the last one is low Fowler's position or 30 degrees head of bed elevation. So this is to prevent aspiration during tube feeding, relieves back pain, considered as the best position for patients to rest. The fourth one is dorsal recumbent. So it's lying on the back with arms to sides, knees bent, feet flat on bed. So nakabukang kang yung pasyente. So its purpose is for perineal care, physical exam of genital and abdomen, perineal exam during labor. So ganito rin ang posisyon kapag ayun nga maglilinis ka sa female patient ng kanyang perineal. Next is lithotomy position. So it's lying on the back with knees flexed above the hips and legs supported by stirrups. So ang difference po neto kay dorsal recumbent is better viewing po ito sa lithotomy. Supported siya ng stirrups, nakapatong yung paa ni patient sa stirrups, kaya mas nakabuka. So ganito po ang position kapag manganganak, normal spontaneous delivery of a neonate, for vaginal, pelvic, and gynecological surgery and examination. So, better vision kasi dun sa genital ng female patient. Ayan. Next is seams position, or we call it semi-prone position or lateral position. So the patient lies on their left side or right side with right hip and knees bent. So ano nga ba ito sa Tagalog? So, nakatagilid siya, tapos nakadantay siya. Ayan. So, ganito po ang position kapag mag-fleet enema yung pasyente. So, naka-left lateral seams position siya. Why do we do this? For better visualization po ng perineum at colon. It also reduces pressure on the hips and sacrum, allows secretions to drain. So, yung recovery position natin, no, ganito siya, nakatagilid din yung pasyente. Ayan, so this is how seams position or lateral position, semi-prone position looks like. So nakadantay yung pasyente on it's on his or her left side. Ayan. Next is orthopnic position. So, naka-sit upright naman si patient, kaya lang naka-forward po ang pasyente, leaning slightly forward. Tapos, ayan, nakikita niyo supported siya ng pillow. It's pillow or overbed table. So, why do we do this? To assist the patient with severe respiratory distress. So, for example, maraming plema yung pasyente, ninebulize mo na. So, you do the orthopnic position sa patient, tapos itap-tap mo yung likod niya. Ayan, so that's orthopnic. So next is Trendel and Work position. So it's lying on the back with arms on the side. The foot is higher than the head. So ginagawa ito tuwing, for example, may abdominal surgeries. Ayan. So that's Trendel and Work position. So last is reverse Trendelenburg position. So this one is the opposite po nung Trendelenburg position. So it's lying on the back with arms on the side. Kaya lang mas mataas po yung head than the foot of bed po. So we do this kapag, for example, mga procedures na sa higher extremities or upper part of the body. So like angiography, ayan. So that's reverse Trendelenburg. Okay, so congratulations. Palakpakan natin ang ating mga sarili. So you did great. Ayan, so let's test our knowledge this time. Ayan, so yung next part ng ating discussion and simulation is the um, short quiz. Ayan, so put your answers sa comment section. So number one question, the patient is complaining of difficulty of breathing or inbreathing. You're assigned to a patient with cardiac problem. What is your first step and what position is applicable and why? Ayan. Second question, you're going to clean the perineal area of a female patient prior her vaginal delivery as ordered by the doctor and with approval of your nursing supervisor. What position is applicable and why? Second question, next, you're going to remove the catheter of a female patient post CS or when you say post CS, post cesarean section delivery. What are your instructions to your patient and what position is applicable? Next, you're going to remove the catheter of a female patient post CS or when you say post CS, post cesarean section delivery. What are your instructions to your patient? And so next is you're preparing for a patient for enema. You know that the best position for enema or cleansing enema would be. So next is you're preparing for a patient for enema. You know that the best position for enema or cleansing enema would be. So next is you're preparing for a patient for enema. You know. And last question, you're about to transfer a patient post-opsys delivery to her room. Anong position and how are you going to move the patient from stretcher to her bed? And last question, you're about to transfer a patient post-op CS delivery to her room. Anong position and how are you going to move the patient from stretcher to her bed? Ayan, excited na ba kayo kung nakailan kayo? So it's rationality time. Okay, so the first question, the patient is complaining of difficulty of breathing. You're assigned to a patient with cardiac problem. What is your first step and what position is applicable and why? So kapag sumasagot po tayo ng ganitong tanong, we have to keep in mind, ayan, first step daw. So we know na difficulty of breathing is a priority. Bakit? Remember, ABC of life, airway, breathing, and circulation, that's our priority. Kapag nahihirapan huminga, it can be the airway or the breathing that has problem. So, ang initial action lagi po is independent intervention o yung pwede na natin gawin sa pasyente. Which is number one, of course, assess vital signs, and next is positioning. So what's the answer? So that's Fowler's or semi-Fowler's position. So this is for better lung expansion. 'Di ba kapag ikaw nahihirapan ka huminga, pag nakahiga ka para kang malulunod. I mean kapag meron kang cough or cold or meron kang ubo-sipon, so pag nakahiga ka para ka nang mamamatay or malulunod. And then when you get up, pag nakaupo ka, nare-relieve ka. It's actually because kapag nakaganito kang position, better lung expansion po. Next is you're going to clean perineal area of a female patient prior her vaginal delivery, ordered by the doctor and with approval of your nursing supervisor. What position is applicable and why? So ano nga ba ang position kapag nagpiperineal care? That's dorsal recumbent. That's for better vision po ng genitals. Next, you're going to remove the catheter naman. So, post-CS pa rin yung pasyente. What are your instructions to your patient and what position is applicable? So, kapag magtatanggal po, still the same dorsal recumbent for better vision po ng genital. However, another question po na kailangan i-address, ano daw instruction natin sa pasyente? So, kapag magtatanggal ka ng catheter, so you have to just ask the patient, breathe in, and then breathe out. Okay? Habang tinatanggal mo yung catheter para ma-relax po siya. Medyo mahapdi lang siya sa pakiramdam. Di naman gaanong masakit but still uncomfortable for the patient. Okay, so number 4, you're preparing a patient for enema. You know that the best position is, we know na it's left lateral or Sims position on the left side. So why on the left side? Kasi po, yung anatomy po ng ating intestine or ng bituka is nakaganito po sa left side. So if nag-right ka, right lateral, so walang pupuntahan yung tubig. So it has something to do with the anatomy of our intestine or bituka. Next is you're about to transfer a patient post-op CS delivery to her room. What position is the best position post-op and recovering from anesthesia? So we know na it's supine position without a pillow. That is to avoid spinal headache. And then kapag ita-transfer mo yung pasyente, of course, hindi mo siya gagalawin from flat position. Hindi mo siya upuin or whatever kasi nga nagre-recover yan from anesthesia. So, you should maintain the patient na naka-flat or supine position in transferring. Okay, so that's it mga kaPORKliners. So, kamusta naman ang mga score nyo? So, comment nyo lang po kung nakailang kayo. And I hope na may natutunan po kayo sa video na to. So, if you think na beneficial po sa inyo itong mga videos ko, for more informative videos like this, mag-subscribe ka sa aking channel, follow mo ako sa TikTok and sa Facebook. Ayan. So, bye mga kaPORKliners. Have a wonderful day.